Welcome to this presentation of a study of the association between community participation and quality of life and recovery for parents with a mental illness. Parents who have a mental illness are a unique population since they experience the challenges of parenting and of having a mental illness. This work builds on existing research that showed an association between community participation and quality of life and recovery for those with a mental illness. Community participation is when individuals can choose to take active and valued roles in a variety of areas that are important to them within the community. It can be seen as the active embodiment of well-being. We examine the relationships between community participation and quality of life and recovery, specifically for parents with a mental illness. Participants were 496 adults with a serious mental illness who had children of any age. The majority of participants were female. 54% were Black and 39% were white. 57% were a primary caregiver for a child under 18. Items of the Temple University Community Participation Measure, or TUCP, were grouped into three categories: productive activities such as working for pay or going to school, social activities such as attending religious ceremonies or getting together with family and friends, and leisure activities, such as going to a restaurant or to a library. Sufficiency of community participation was measured by the proportion of activities in a category that participants rated as important to them and done enough, out of the total number of important activities in that category. We calculated Pearson correlation coefficients to assess bivariate relationships between sufficiency of participation in each category and quality of life, measured by Lehman's Quality of Life Measure, and recovery, measured by the Recovery Assessment Scale. We also performed independent sample t-tests for each item of the TUCP, comparing the quality of life and recovery scores of those who indicated that the activity was important to them and that they did enough, to those who indicated that the activity was important but not done enough. We found that there was a modest positive correlation between sufficiency of participation in each category and quality of life scores. However, only the social and leisure categories were significantly correlated with recovery scores. Sufficiency in the productive category was not significantly related to recovery. We found that for every individual item, there was a significant difference in quality of life between those indicating that they did enough of the activity versus those who did not. For recovery, doing each item enough resulted in a higher recovery score, but statistical significance was only achieved for about half of the items. Overall, we saw that sufficiency of community participation was associated with higher quality of life and recovery for parents with a mental illness. These findings suggest avenues for intervention programs for parents with a mental illness that could facilitate their community participation. They support the growing movement of community integration for those living with a mental illness. They also suggest further research into the difference between how social and leisure activities versus how productive activities affect recovery. Thank you for your time.